Welcome to the RYBELSUS Virtual Roundtable Talk with Jennifer Goldman. Please see important safety information throughout and link above for prescribing information, including boxed warning. Indications and usage. RYBELSUS semaglutide tablet 7 mg or 14 mg is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. Limitations of use. RYBELSUS is not recommended as a first-line therapy for patients who have inadequate glycemic control on diet and exercise because of the uncertain relevance of rodent C-cell tumor findings to humans. RYBELSUS has not been studied in patients with a history of pancreatitis. Consider other antidiabetic therapies in patients with a history of pancreatitis. RYBELSUS is not indicated for use in patients with type 1 diabetes. Important safety information. Warning: risk of thyroid C-cell tumors. In rodents, semaglutide causes dose-dependent and treatment duration-dependent thyroid C-cell tumors at clinically relevant exposures. It is unknown whether RYBELSUS causes thyroid C-cell tumors, including medullary thyroid carcinoma (MTC) in humans, as human relevance of semaglutide-induced rodent thyroid C-cell tumors has not been determined. RYBELSUS is contraindicated in patients with a personal or family history of MTC and in patients with multiple endocrine neoplasia syndrome type 2, MEN2. Counsel patients regarding the potential risk for MTC with the use of RYBELSUS and inform them of symptoms of thyroid tumors. For example, a mass in the neck, dysphagia, dyspnea, persistent hoarseness. Routine monitoring of serum calcitonin or using thyroid ultrasound is of uncertain value for early detection of MTC in patients treated with RYBELSUS.
Hi Dan, Chris. Thanks for speaking to us today about how RYBELSUS resources have been able to support your work as pharmacists. I'd like to get to know you a little bit more, so why don't you tell us about yourself?
Well, I've been a pharmacist for Hannaford Supermarkets for a little over 2 years now, and I love it. I just love being able to support my patients.
Absolutely. I've been a community pharmacist for 10 years, and I also do this because it's so worth it knowing that you create a positive effect on the patient's life.
I'm sure your patients appreciate that kind of care. So your workday must get very busy. What's a typical patient interaction look like for you?
That's right. I only get to spend about 8 to 10 minutes with each patient, so being able to properly communicate how and when to take medication is always top of mind for me.
Same goes with me. And any patients coming in starting a new treatment usually have questions, especially regarding administration. So I want to be that point of contact to answer them. So, any type of visual aid, like a brochure, is always a helpful resource for those conversations.
Sounds like making the most of those conversations is crucial. Speaking of resources, RYBELSUS has many pharmacist-specific resources. The Pharmacy Connect hotline to process the copay offer, the dosing card, the pharmacy kit, and the patient starter brochure. I'm curious, have either of you used any of these resources? Have any of these ever come in handy throughout your day or your interactions with your patients?
Definitely. In fact, I've used almost all of these at one point or another. Like I'll go online to RYBELSUSPro.com all the time to get the savings offer info for my patients. The dosing card is always very helpful too. I actually just used it the other day.
After going over the RYBELSUS safety information, I showed a patient step-by-step how to use RYBELSUS. It helped clear up any questions they had, which was great.
Same here, Chris. That patient starter brochure has been very helpful. It goes through the important safety information and it breaks down the administration steps in a way that helps me talk about starting RYBELSUS in clear terms. I also frequently use the Connect hotline. It's a great way to quickly get the information I need when processing the RYBELSUS savings offer.
That's great to hear. I'm glad the resources have been able to help you out in more ways than one. I'm sure the RYBELSUS sales reps have also been a great resource.
Oh, absolutely. And staying up to date on medications and market is an essential part of our job. So any time with my RYBELSUS rep is extremely valuable.
So when speaking to other pharmacists, what would you tell them about RYBELSUS?
I would say to other pharmacists to look at the RYBELSUS data against some of the other oral type 2 diabetes medications. Maybe they have patients who could benefit from making a switch to RYBELSUS. It's an easy conversation they can have with the patient's doctor, and if they do have patients on RYBELSUS, take advantage of the resources. They will help you educate your patients.
That's really good advice, Dan. So before we end, do either of you have any closing thoughts?
Yeah, I just wanted to point out that the RYBELSUS resources have empowered my team with the counseling language and tools required to send my patients home with the confidence and understanding of exactly what they need to do.
Nicely put, Chris. I can't top that.
Thanks so much. This was really, really great.
Thank you. We had a great time.
Important safety information. Contraindications. RYBELSUS is contraindicated in patients with a personal or family history of medullary thyroid carcinoma, MTC, or in patients with multiple endocrine neoplasia syndrome type 2, MEN2, and in patients with known hypersensitivity to semaglutide or to any of the components in RYBELSUS. Warnings and precautions. Risk of thyroid C-cell tumors. Patients should be further evaluated if serum calcitonin is measured and found to be elevated, or thyroid nodules are noted on physical examination or neck imaging. Pancreatitis has been reported in clinical trials. Observe patients carefully for signs and symptoms of pancreatitis, including persistent severe abdominal pain, sometimes radiating to the back, and which may or may not be accompanied by vomiting. If pancreatitis is suspected, discontinue RYBELSUS and initiate appropriate management. If confirmed, do not restart RYBELSUS. Diabetic retinopathy complications. In a pooled analysis of glycemic control trials with RYBELSUS, patients reported diabetic retinopathy-related adverse reactions during the trial, 4.2% with RYBELSUS and 3.8% with comparator. In a 2-year trial with semaglutide injection involving patients with type 2 diabetes and high cardiovascular risk, more events of diabetic retinopathy complications occurred in patients treated with semaglutide injection, 3%, compared to placebo, 1.8%. The absolute risk increase for diabetic retinopathy complications was larger among patients with a history of diabetic retinopathy at baseline than among patients without a known history of diabetic retinopathy. Rapid improvement in glucose control has been associated with a temporary worsening of diabetic retinopathy. Patients with a history of diabetic retinopathy should be monitored for a progression of diabetic retinopathy. Warnings and precautions. Hypoglycemia. The risk of hypoglycemia is increased when RYBELSUS is used in combination with insulin secretagogues, for example, sulfonylureas or insulin. Patients may require a lower dose of the secretagogue or insulin to reduce the risk of hypoglycemia in this setting. Acute kidney injury. There have been post-marketing reports of acute kidney injury and worsening of chronic renal failure, which may sometimes require hemodialysis in patients treated with GLP-1 receptor agonists, including semaglutide. Some of these events have been reported in patients without known underlying renal disease. A majority of the reported events occurred in patients who had experienced nausea, vomiting, diarrhea, or dehydration. Monitor renal function when initiating or escalating doses of RYBELSUS in patients reporting severe adverse gastrointestinal reactions. Hypersensitivity. Serious hypersensitivity reactions, for example anaphylaxis, angioedema, have been reported with GLP-1 receptor agonists, including semaglutide. If hypersensitivity reactions occur, discontinue use of RYBELSUS, treat promptly per standard of care, and monitor until signs and symptoms resolve. Use caution in a patient with a history of angioedema or anaphylaxis with another GLP-1 receptor agonist. Adverse reactions. The most common adverse reactions reported in greater than or equal to 5% of patients treated with RYBELSUS are nausea, abdominal pain, diarrhea, decreased appetite, vomiting, and constipation. Drug interactions. The risk of hypoglycemia may be lowered by a reduction in the dose of concomitantly administered secretagogues or insulin. RYBELSUS delays gastric emptying and has the potential to impact the absorption of other oral medications. Closely follow RYBELSUS administration instructions when co-administering with other oral medications, and consider increased monitoring for medications with a narrow therapeutic index, such as levothyroxine. Use in specific populations. Pregnancy. Available data with RYBELSUS are not sufficient to determine a drug-associated risk for major birth defects, miscarriage, or other adverse maternal or fetal outcomes. Based on animal reproduction studies, there may be risks to the fetus from exposure to RYBELSUS. Use only if the potential benefit justifies the potential risk to the fetus. Lactation. There are no data on the presence of semaglutide in human milk, the effects on the breastfed infant, or the effects on milk production. Because of the unknown potential for serious adverse reactions in the breastfed infant due to the possible accumulation of salcaprosate sodium, SNAC, an absorption enhancer in RYBELSUS, from breastfeeding, and because there are alternative formulations of semaglutide that can be used during lactation, advise patients that breastfeeding is not recommended during treatment with RYBELSUS. Discontinue RYBELSUS in women at least 2 months before a planned pregnancy due to the long washout period for semaglutide. Pediatric use. Safety and efficacy of RYBELSUS have not been established in pediatric patients younger than 18 years. For more information about RYBELSUS, contact your local sales rep today.